Hi there, Andrew with Zang Physical Therapy, and today I want to talk a little bit about dizziness and neck pain and how if you are suffering with these conditions, you may be able to get them treated without taking medication. Oftentimes, a first-line defense for medical providers for dizziness is giving them some kind of medication, possibly meclizine or Anavert or something very similar. And for some people, this does help. It can reduce the intensity or frequency, but it doesn't necessarily solve the problem at hand. In a similar light, people who have just ordinary neck pain, they're popping ibuprofen, Aleve, Motrin, Tylenol, etc. Again, it may help to dull the symptoms that a person feels, but it doesn't necessarily solve the problem that they have. So, there's a percentage of people out there who have both of these conditions at the same time, neck pain and dizziness. It's something that we call cervicogenic dizziness, or dizziness that's derived from your neck, if we break it down. And oftentimes these individuals will become symptomatic or dizzy, so to speak, with merely turning their head side to side, maybe looking up and down, something along those lines. And it can be quite debilitating for some individuals who have these problems. And oftentimes these people have seen multiple providers, possibly the primary care, possibly a neurologist, maybe some other, maybe an ENT, but oftentimes people don't think about physical therapists helping this problem. In actuality, we can be quite effective in treating this. When your dizziness is derived from your neck, there are ways to treat your neck via some soft tissue techniques, via some muscle retraining techniques that we can teach people to do that can actually reduce this dizziness. So, all these people who have struggled with these issues for maybe days, weeks, months, or longer, and you haven't had a solution, and you've tried multiple different medications, how about you try something that doesn't involve medications? What do you have to lose by coming to a physical therapist, by getting screened, and seeing if this really is your problem? And if it is your problem, there is a solution, again, that doesn't necessarily require medication, so we can get off those medications. You can stop going to multiple doctors' visits, which aren't providing you the solution that you need and want. If in the end, we evaluate you and don't see anything or can't provoke it like we expect and it's not changing, we're more than happy to punch you back to the right medical provider who may be able to help you. But chances are, if you are someone who has dizziness and neck pain together, we can help you. You may also notice that you have trouble focusing to read a book, to look at stare at a computer screen. Things like that can be impacted as well. So if you're having trouble with any of those things that I'm talking about, just turning your head to look out your side mirror makes you feel dizzy. You get dizzy looking up into a cabinet to get to plate or glass or something like that. You get dizzy bending down to tie your shoe. Again, maybe it's just dizziness, maybe it's dizziness with neck pain. Whether it's one or both, these are conditions that physical therapists can help treat and help get you back to functioning in life without feeling so off-balance, without feeling like you're just not getting a solution to your problem. So, if any of this is you, please don't wait another day. Pick up the phone, call a physical therapist. If you're not living in my area, if you're living in the Harrisburg area, by all means reach out to me. I'd love to learn more about what your problem is, what you want to change, what you want your solution to be, and I'll open and honestly tell you if it's something that I think I can help. If not, I will do my best to direct you to a provider who can very likely help your problem. So, hopefully this information was helpful. Again, if you have dizziness and neck pain, please reach out. If you're suffering and have questions, post a comment, send me an email. I love to continue the conversation, but above all, I want you to be able to walk around and function without neck pain and or dizziness. Alrighty, have a very nice day.